Hey, stop what you're doing right now. Because if you wake up every morning with a dry mouth, your body may be sending you a warning signal that most people completely ignore and never thought about. And I say that not to frighten you, but because dry mouth is one of the most consistently overlooked signs of underlying health issues that modern medicine is now taking increasingly seriously. Let Dr. Amelia Foster explain to you.
Hey everyone, I'm Dr. Amelia Foster, integrative medicine physician and oral health researcher, 24 years of experience studying the connection between oral health and systemic disease. And what I've discovered through reviewing research from multiple major institutions is that waking up with dry mouth is rarely just about dehydration or sleeping with your mouth open. Some research suggests it may be your body's way of signaling 5 specific underlying health concerns, each one more significant than the last. Now, before we continue, I want to be completely clear. This is general educational information only. This is not medical advice. If you experience persistent dry mouth, please consult with your qualified healthcare provider. What I'm sharing today is information about what some research suggests, not a diagnosis or treatment recommendation. With that said, the research connecting dry mouth to underlying health concerns is genuinely fascinating and important. Today, I'm going to walk you through 5 possible underlying reasons your body may be producing this warning signal every morning, ranked from commonly overlooked to the one that most people never connect to dry mouth at all. And I want to tease something right now. Number 1 on this list is an underlying health concern that some research suggests affects up to 40% of adults over 50, and dry mouth may be one of its earliest and most consistent warning signals. Most people never make this connection. So please, watch this to the end. The information builds. Each sign connects to the last. But before we begin, I want to ask you something personally. Leave a comment below and tell me this. How long have you been waking up with dry mouth? And have you ever mentioned it to your doctor? I read every single comment, and your answers shape what I cover next. Okay, let's get into it, starting with number 5.
Number 5, mouth breathing and airway dysfunction. Number 5 is something that most people assume is the obvious and complete explanation for dry mouth. And while it's a real contributor, most people don't understand the deeper health implications behind it. I'm talking about chronic mouth breathing during sleep. Now, most people think mouth breathing is simply a habit or a consequence of a stuffy nose. But here's what some research suggests about chronic mouth breathing in adults, particularly older adults. Chronic mouth breathing during sleep is frequently a sign of what researchers call airway dysfunction. Your body is not getting adequate airflow through your nasal passages during sleep, and this can have implications far beyond dry mouth. Your nasal passages are not just air channels. They contain structures that filter, humidify, and warm incoming air. They produce nitric oxide, a molecule critically important for cardiovascular health and immune function. When you breathe through your mouth chronically, you bypass all of these functions. Some research has explored associations between chronic mouth breathing and disrupted sleep quality, altered oxygen saturation during sleep, and changes in cardiovascular markers. Additionally, chronic mouth breathing is often associated with what researchers call upper airway resistance, a spectrum of breathing dysfunction during sleep that ranges from simple snoring to more significant conditions affecting sleep quality and oxygenation. A review published in a sleep medicine journal explored the relationship between mouth breathing during sleep and various health markers in adults. The findings suggested that chronic mouth breathing may be associated with more than just dry mouth, potentially reflecting underlying airway issues worth investigating. What to discuss with your doctor? If you consistently wake with dry mouth and suspect mouth breathing, ask your doctor about a sleep evaluation. Ask specifically about upper airway resistance and whether a sleep study might be appropriate. Ask about nasal breathing exercises and whether an ENT evaluation might be valuable. Synergy tip for number 5. Some research suggests that nasal breathing exercises, practiced during waking hours, may help retrain breathing patterns over time. Ask your doctor or a qualified breathing specialist whether this might be appropriate for your situation. That's number 5. But number 4 involves something that affects millions of adults over 60 and is one of the most common and most overlooked contributors to morning dry mouth. Let's talk about it. Number 4, medication side effects and polypharmacy. Number 4 is something that is extraordinarily common in adults over 60, and it's something that most people never connect to their morning dry mouth. I'm talking about medication-induced dry mouth, and specifically, the compounding effect of multiple medications taken simultaneously. Dry mouth is listed as a potential side effect of over 500 commonly prescribed medications. 500. Including antihistamines, antidepressants, blood pressure medications, bladder medications, and many others. In younger adults, a single medication causing mild dry mouth is typically manageable, but in older adults taking multiple medications simultaneously, a situation researchers call polypharmacy, the combined dry mouth effect can be significant and persistent. Here's the mechanism. Many medications reduce saliva production by blocking certain nerve signals to the salivary glands. Saliva is far more important than most people realize. It's not just about moisture. Saliva contains antimicrobial compounds that protect against oral infections. It contains enzymes that begin digestion. It buffers acid in the mouth that would otherwise damage tooth enamel. And some research suggests saliva contains compounds important for oral and systemic immune function. When saliva production is chronically reduced through medication effects, the consequences extend far beyond discomfort. Some research has explored associations between chronic dry mouth and increased risk of dental decay, oral infections, and changes in oral microbiome balance. And some researchers are exploring connections between oral microbiome changes and systemic health. I had a patient, Dorothy, 71 years old, from Edinburgh, a retired schoolteacher who came to me with persistent morning dry mouth that had been worsening over 2 years. She was taking 6 different medications. When we worked with her prescribing physicians to review her complete medication list, 3 of her medications had dry mouth as a documented side effect. Working with her healthcare team, 2 medications were adjusted or substituted where clinically appropriate. Her dry mouth improved significantly within weeks. Dorothy told me, "Nobody had ever connected my dry mouth to my medications before. Every doctor just told me to drink more water." What to discuss with your doctor? Ask your doctor and pharmacist to review your complete medication list for dry mouth as a side effect. Ask whether any medications contributing to dry mouth might have alternatives with a different side effect profile. Never change medications without medical supervision. Synergy tip for number 4. Ask your pharmacist specifically about your medication list and dry mouth. Pharmacists are often underutilized resources for this type of medication review and may identify connections your other healthcare providers have missed. Number 4 is important, but number 3 is where things become genuinely fascinating. And if you're finding this valuable so far, this is a good moment to hit that subscribe button and give this video a like. I release evidence-based health education content every single week, and your support makes that possible. Number 3, autoimmune activity. Number 3 is something that most people would never connect to waking up with a dry mouth, and yet some research suggests it may be one of the most important connections to understand. I'm talking about autoimmune conditions, specifically a condition called Sjögren's syndrome, and more broadly, the spectrum of autoimmune activity that can affect moisture-producing glands throughout the body. Sjögren's syndrome is an autoimmune condition in which the immune system mistakenly attacks moisture-producing glands, including salivary glands and tear ducts. The result is persistent dry mouth and dry eyes. But here's what makes this especially relevant. Some research suggests that Sjögren's syndrome is significantly underdiagnosed, particularly in older adults. Some estimates suggest it may affect up to 4 million people in the United States alone, with many cases undiagnosed. Additionally, some research suggests that dry mouth, particularly when accompanied by dry eyes, joint pain, or fatigue, may sometimes be an early signal of autoimmune activity that deserves investigation. More broadly, some research has explored how the immune system's relationship with moisture-producing glands changes with age and how various autoimmune processes may manifest as dryness symptoms before other more obvious signs appear. A review published in a rheumatology journal explored the diagnostic journey of patients with Sjögren's syndrome. The findings suggested that many patients experience symptoms, including persistent dry mouth, for years before receiving a diagnosis. Early identification and appropriate management were associated with better outcomes. What to discuss with your doctor? If you experience persistent dry mouth, particularly combined with dry eyes, unexplained fatigue, or joint discomfort, ask your doctor specifically about autoimmune evaluation. Ask whether testing for Sjögren's syndrome or other autoimmune markers might be appropriate for your situation. Synergy tip for number 3, keep a simple symptom diary, noting not just dry mouth but any other symptoms, dry eyes, joint discomfort, unusual fatigue. Patterns across multiple symptoms are far more clinically informative than any single symptom in isolation. Bring this diary to your doctor. Number 3 is significant, but the next 2 are where things become genuinely important. Number 2, blood sugar dysregulation. Number 2 is a connection that some research suggests is one of the most clinically significant links to morning dry mouth, and one that most people never make. I'm talking about blood sugar dysregulation, and specifically the early stages of insulin resistance and prediabetes that may manifest as persistent dry mouth before other, more obvious symptoms appear. Here's the mechanism that makes this connection so important. When blood sugar levels are elevated, even in the early stages of dysregulation, the kidneys work harder to filter excess glucose from the blood. This process draws water from the body's tissues. The result is increased urination and, critically, reduced fluid available for saliva production. Additionally, elevated blood sugar affects the function of the small blood vessels that supply salivary glands. Some research suggests that even modest blood sugar elevation below the threshold for a diabetes diagnosis may affect salivary gland function and reduce saliva production. This means that persistent morning dry mouth may sometimes be an early signal of blood sugar dysregulation, appearing before classic diabetes symptoms like increased thirst, frequent urination, or fatigue become obvious. A study published in a diabetes research journal explored oral symptoms in adults with early-stage insulin resistance. The findings suggested that dry mouth was among the earlier reported symptoms, sometimes appearing before blood sugar levels reached diagnostic thresholds for diabetes. And here's what makes this especially significant for adults over 50. After age 50, insulin sensitivity naturally declines. The prevalence of prediabetes and undiagnosed type 2 diabetes rises substantially with age. Some estimates suggest that a significant proportion of adults over 65 have prediabetes or undiagnosed diabetes. I had a patient, Gerald, 68 years old, from Toronto, a retired architect who came to me specifically about persistent morning dry mouth that had been bothering him for about a year. He had no other obvious symptoms. His fasting blood sugar at his last annual check had been in the normal range. But when we ran a more comprehensive blood sugar evaluation, including a hemoglobin A1C and a glucose tolerance test, we found early-stage insulin resistance. Gerald had no idea. His dry mouth had been his body's earliest warning signal. With appropriate lifestyle modifications, discussed with his healthcare team, his blood sugar markers improved over 6 months, and his dry mouth improved along with them. Gerald told me, "I almost didn't mention the dry mouth. I thought it was too trivial to bring up. It was anything but trivial." What to discuss with your doctor? If you experience persistent morning dry mouth, ask your doctor specifically about comprehensive blood sugar evaluation, not just fasting glucose, but hemoglobin A1C and potentially a glucose tolerance test. Ask whether your blood sugar regulation has been comprehensively evaluated recently. Synergy tip for number 2. Some research suggests that morning dry mouth combined with increased nighttime urination and morning fatigue may form a cluster of early blood sugar dysregulation signals worth discussing with your doctor. Note whether you experience any combination of these symptoms and bring this information to your next appointment. This is number 2 and it is significant. But what I'm about to share for number 1, the underlying health concern that some research suggests may affect up to 40% of adults over 50 and that most people never connect to dry mouth. This is what the research has been quietly building toward. This is the one. Number 1, sleep-disordered breathing and oxygen dysregulation. Number 1 is a condition that some research suggests is dramatically underdiagnosed in older adults, and that persistent morning dry mouth may be one of its most consistent and reliable early warning signals. I'm talking about sleep-disordered breathing, and specifically obstructive sleep apnea and its related spectrum of conditions. Sleep-disordered breathing occurs when the upper airway partially or completely collapses during sleep, causing interruptions in breathing that reduce oxygen levels and fragment sleep quality. Some research suggests that sleep apnea may affect a substantial proportion of adults over 50, with many cases undiagnosed. And here's the critical connection to dry mouth. When your airway is obstructed during sleep, your body compensates by breathing through your mouth. This is not a conscious choice, it's an automatic response to airway obstruction. The result is persistent, significant mouth breathing and persistent morning dry mouth. But the dry mouth is just the surface signal. Here's what's happening deeper. During episodes of sleep apnea, your oxygen levels drop, your heart rate fluctuates, your body experiences repeated micro-stress responses throughout the night, activating your sympathetic nervous system, releasing stress hormones, elevating inflammation markers, all while you sleep, all without your awareness. Some research has explored associations between untreated sleep apnea and cardiovascular health, metabolic function, cognitive function, and various other systemic health markers. The research suggests that the consequences of untreated sleep-disordered breathing extend far beyond poor sleep quality. And here's what makes morning dry mouth such a potentially valuable warning signal. It's consistent, it's noticeable, and it appears every single morning reliably in people with sleep-disordered breathing. Think of your morning dry mouth like a check engine light in your car. The dry mouth itself is not the problem. It's the signal that something deeper deserves attention. A major sleep research journal published findings suggesting that self-reported morning dry mouth was among the symptoms most consistently associated with objectively confirmed sleep-disordered breathing in a large adult population. Importantly, many of these patients had not previously suspected they had sleep apnea. And here's the devastating statistic that makes this number one. Some research suggests that sleep apnea in older adults is associated with increased risks of cardiovascular events, cognitive decline, metabolic dysfunction, and reduced quality of life. And yet some estimates suggest that up to 80% of moderate to severe sleep apnea cases in adults remain undiagnosed. Your morning dry mouth may be the signal that changes all of this.
I had a patient, William, 72 years old, from Melbourne, a retired engineer who came to me about persistent morning dry mouth combined with what he described as never feeling rested no matter how much he slept. His wife had mentioned that he snored heavily. He had attributed his fatigue to aging and his dry mouth to sleeping with his mouth open. When we arranged a sleep study, William was found to have moderate obstructive sleep apnea, with oxygen desaturation events occurring multiple times per hour throughout the night. With appropriate treatment, discussed and managed by his sleep specialist, his sleep quality improved dramatically within weeks. His morning dry mouth resolved. His energy improved substantially. His cardiovascular markers improved at his 6-month follow-up. William told me, "I had been waking up with dry mouth every morning for 3 years. I thought it was just something that happened when you got older. I had no idea my body was telling me something important." It was telling him something critically important. To explore whether sleep-disordered breathing might be relevant to your morning dry mouth, discuss these things with your doctor without delay. Tell your doctor about your morning dry mouth, specifically that it is persistent and consistent every morning. Ask whether a sleep evaluation might be appropriate. Ask your bed partner whether they've noticed snoring, gasping, or breathing pauses during your sleep. Note whether you experience morning headaches, daytime fatigue, or difficulty concentrating. These may form a pattern worth discussing. Synergy tip for number 1. Combine your conversation about morning dry mouth with information about your sleep quality and daytime energy levels. A comprehensive picture, dry mouth plus fatigue plus snoring plus morning headaches, is far more clinically compelling than dry mouth alone. The more complete the picture you present to your doctor, the more likely you are to receive a thorough evaluation. All of the research referenced throughout this video is linked in the description below. I encourage you to read it. Share it with your doctor. Ask the questions that your appointments often don't leave time for. Here is what I want you to hear as we close. Your body is constantly communicating with you. Every symptom, even one as seemingly trivial as waking up with a dry mouth, is a signal worth paying attention to. You are not imagining it. You are not overreacting. You are listening to your body, and that listening may be one of the most important things you ever do for your health. Whether you are 50 or 80, whether you've had a dry mouth every morning for a week or for years, whether you've mentioned it to a doctor or dismissed it as insignificant, the information you now have is genuinely valuable. These 5 possible underlying signals, mouth breathing and airway dysfunction, medication side effects, autoimmune activity, blood sugar dysregulation, and sleep-disordered breathing, are not reasons to panic. They are reasons to have an informed, proactive conversation with your healthcare provider. Don't let anyone tell you that a symptom is too trivial to mention. The research says otherwise, and so do I. If this video helped you, please subscribe to this channel and share it with someone you care about, particularly someone who has been dismissing their morning dry mouth as insignificant. Every week we go this deep into evidence-based health education, and your support makes that work possible. And now I want to hear from you. Which of these 5 possible underlying causes surprised you the most? And how long have you been experiencing morning dry mouth? Leave your answer in the comments. I read every single one.